Hi there, you must be my next patient. I'm Dr. Mint. Nice to meet you. Okay, so it looks like you're here for a pelvic exam, correct? Perfect. Okay, so my computer is actually down, so I'm taking all of my notes in my notebook today. But would you just confirm your name and date of birth for me? Okay, and then just spell the last name. Great, and then date of birth. Awesome. Okay, so this is a pelvic exam. I know that can make people a little nervous, but there's no reason to have any nerves. I've done this many times before, but since you are a male, before we start, I always like to make my patients aware that if for whatever reason you feel uncomfortable or prefer a male doctor, we can 100% do that. You're okay with me? Okay, yeah, no worries. And I'm gonna make sure as we're going that I'm explaining everything that I'm doing. And if you have any questions or ever feel uncomfortable at any time, please let me know and we can take a break. Okay, but first I'm just gonna start super easy questions. Okay, let's see. Start. How physically active are you? Just how many times do you work out, say, during a week on average? Okay. Yeah, no, that's a good number. It's very important to make sure you're getting physical activity in, ideally each day. Okay, yeah. All right, and then would you consider yourself someone who eats pretty healthy, or do you have a lot of junk food weekly? Okay, awesome. And how many glasses of water do you think you get per day? Okay, okay. All right, and then I'm just gonna have you take a step over there. There is a scale, and I'll also take your height. And if you could just go stand on it and then read off what it says for me. Okay. Great. Perfect. Okay. Now we're gonna get into a little bit of personal questions, but don't worry, no big deal, no big deal. All right, are you currently sexually active? Okay. And are your partners male, female, or both? All right. And during those encounters, are you using protection? Okay. Great. Yes, always very important to use protection. You never want to catch anything that you can't throw back, right? Exactly. Okay, I'm gonna put my gloves on real quick because I am just gonna take your heart rate and I'll just do that on your wrist real quickly. Once I figure out how to put gloves on. Okay, if you could just give me your wrist, I'm just gonna put my 2 fingers there and take your pulse. Okay. Okay, good. That's a good resting heart rate. We got 67 beats per minute. That's good. Yeah, really good for your age range. Okay. And now, after that, I'm going to explain you're going to do a urine sample. And now this is going to help me look for any kind of STIs, STDs. Just because you are a sexually active person, that kind of stuff can happen. So what we are going to do is a clean catch urine sample. So first you're going to go in, you're going to wash your hands. You will take the sanitization wipe, obviously, open it, and then you will move any foreskin if that's applicable to you. You will use the wipe to sanitize the head of your penis. And you will begin by urinating into the toilet. After you've done that for like a second or two, you will take the container and catch the urine without stopping going pee. And just fill it to the line. You will close it. There's with the cap, and then there'll be markers in there. Please just write your name on it and then put it on the specimen shelving area. And after you've done that, there are also gowns in there, and I'll just have you undress from the waist down, and then you will be ready for the pelvic exam. So do you have any questions before I leave the room and give you some privacy? Okay. Yeah, so you'll just come out, and you can stay seated when you come in, or when I come back in. I'll just need you to stand so I'm in the proper position to do the exam, because you'll be standing and I will be seated. All right, I'll be right back. Hello. So I'm just gonna have you keep the robe on for now, and we are just gonna chat about how the rest of this examination is gonna go, because I always like to preface a pelvic exam on a male with that I will be touching an organ that doesn't respond to physical stimulus. So by no means is it uncommon or embarrassing to get an erection during this procedure, basically. It's an organ that responds to touch, so it's something that can happen. Plus, if you're feeling any kind of nerve stuff, that can cause that as well. So it is not an uncommon thing, but if you ever need to have a break and have us stop for a moment, we can totally pause and just wait things out. Okay, yeah, just want you to know that during any time during this, that if you were to ever feel uncomfortable, to let me know and we can just take a break. That easy. Okay, cool. So for starters, we are gonna start with a visual examination. So what I'll have you do is just remove the robe, and I am just going to be visually examining, and I will have you move your penis and scrotum while I just kind of take notes about what I am seeing. During this examination, I'm going to be looking for like edema, excoriation, arrhythmia, lesions, which is basically just like swelling, any kind of scratches or abrasions, redness, or any kind of lumps, bumps that it shouldn't really be there. And I'll just be visually examining the area from about like the top of your waist or hips down. Okay, and then once we've done that, then we will move to the physical portion where I will be touching you. Okay? All right, so let's begin. I'm just gonna have you disrobe. Thank you. Okay, let me grab my notebook. So I will just start with the physical exam. You don't need to do any kind of movements just yet. I'm just gonna take a peek, and I will let you know when things need to be moved. Okay. All right. I don't think I see any signs of anything abnormal. Now, if I could just have you grab your penis and just lift it straight up so I can look at the underside. Okay. Again, nothing weird, nothing abnormal. Looks great. And now just keep holding. I'm going to examine the scrotum. Okay, good. And now, if you could please lift to your scrotum so I could see the posterior side of it. Okay. All right, great. Nothing abnormal there. Don't see any kind of scratches. So next is gonna be the physical, where I am physically touching you. So I'm going to be palpating your penis first, and that's basically where I'm gonna take my thumb and these two fingers, and I will just be not too hard, pretty gently, just squeezing. And then I'll be looking for is if there are any areas of firmness that shouldn't be there, any kind of lumps, bumps, or if you find anything that is tender while I am pressing. But let me just ask, do you ever notice any kind of painful areas on your penis or testicles? Just from like every day, not like, yeah, nothing like if they were like, you know, hit pretty hard or anything. Gotcha. Okay. Nothing like that. Great. Okay. So for this part, I'm just still kind of, again, looking for stuff that I already mentioned before: redness, swelling, scratches, lumps, bumps, but I will be also checking for discharge. So as I'm palpating, once I get to the head of the penis, you know, when you squeeze it, kind of opens the urethra. So I'll be looking for if there's any abnormal discharge coming out of that area. Okay, so let's begin. I'm just gonna start palpating. And again, just let me know if anything makes you uncomfortable or if you need a break. All right. And also please stop me and let me know if there's anything that's too tender. Okay. Now I'm just gonna look into the urethra. All right, I don't see any abnormal discharge. That is great. Okay. All right. And now I'm going to be doing the same thing with your scrotum. I'm just gonna have you hold your penis just out of the way as I will be feeling around your testicles again. Same kind of things: redness, swelling, lumps, bumps, any like abnormal tenderness in that area. Okay. All right. Let's begin. Let me know if it feels anything weird. I'm just gonna kind of poke around and move the structures basically as gently as I can. Okay, check the other side. Okay. Again, everything looks normal, nothing to worry about. Great. Okay. And now for this last portion of the exam, I'm gonna again be touching your scrotum and kind of moving all of the structures out of the way. And this will be like the turn your head and cough kind of thing. Yeah, okay. You're kind of familiar with that? All right. So yeah, I will just kind of reach my hand up and then I'll have you turn your head away from me and cough. And what this is doing is I'm going to check for any hernias while I have my fingers placed. If when you cough, if I were to feel any kind of lumps, bumps, that would be indicative of a hernia. So normally when you cough, I should be able to, there should be no change in any feeling on my fingers. Okay, so we'll just start. I'm just gonna do each side. So I'm gonna start over here. Okay, awesome. I have my fingers placed. Now if you could just turn your head away from me and cough. Okay, and could you cough one more time? Thank you. And once more. Okay, perfect. That was great. Didn't feel anything. Didn't feel anything. That shouldn't be there, right? Okay. Now let me just go to the other side. Okay, and now my fingers are placed. Now again, please turn your head. Thank you, and cough. Okay, again. All right, and could you cough for me one more time? Okay, perfect. Everything's feeling like it should be. That is great news. See, super easy examination, really quick. So you can feel free to grab your robe now. I don't believe there is anything to be worried about for you. Just know that it's important to get testicular screenings on a regular basis. It should be start since you're 18, and then probably Yeah, just make sure you're doing it pretty regularly. You know, this is something you want to be checking on for any kind of like testicular cancer, stuff like that. It's very important to catch things as early as possible. Great. Okay, let me get these gloves off now. We're done with the examination. So final thoughts. Just that you will be receiving a call with the results of your urine sample, probably within the next week or so. If not, please call us and make sure that they get in touch with you. Make sure you're scheduling your next checkup. You can do that with reception as you leave. And I think that is everything I have for you. Do you have any other questions? Nope. Okay, great. No, it was lovely getting to do this checkup with you, and I hope it was just as quick and easy as I said. I will see you at your next appointment. Have a good rest of your day. Bye-bye.